This is our presentation. It is palliative care for pediatric patients with cancer. I'm Madison.
I'm Emily.
I'm Shay.
And I'm Gentry.
So we're going to start talking about palliative care for pediatric cancer. I would first like to start off with the presentation by giving some statistics about pediatric cancer. Every day, 43 children are diagnosed with cancer. The average age of diagnosis is 6. Cancer is the second leading cause of death in children 1 to 14. Only 4 treatments in the last 20 years have been specifically developed for childhood cancer. 4% of federal funding goes to researching pediatric cancer, and nearly 2,000 children die annually due to malignancies. So I'd like to give your attention to the pie chart on the side. The pie chart is from the American Cancer Society, and it shows the type of cancer that children are diagnosed with. In the light blue, you can see that acute lymphoblastic leukemia is the largest area and accounts for 20% of pediatric cancer diagnosis. The other graphic is from CureSearch and shows that 1 out of 8 children diagnosed with cancer do not survive.
So in discussing palliative care for children, an understanding of the criteria for referral to palliative care is important. In general, patients who have a progressive disease despite second-line therapy and who suffer emotional and physical symptoms qualify for a referral, like those with an advanced cancer diagnosis and prognosis of about a year. In addition, if a patient requests that their death be hastened, they express a desire for support in planning their care, or are experiencing delirium or metastases to the brain, they may be referred to palliative care as well. For oncological patients specifically, the focus for criteria is on the patient's quality of life and the effectiveness of the treatments they're currently receiving. If the patient's illness is progressing despite treatments, especially to the brain or the spinal cord, causing compression, as well as experiencing malignant hypercalcemia, painful bone metastases, pancytopenia, or are in need for procedures for pain management, they will be referred to palliative care. For many patients with a severe terminal illness, it's important that the healthcare team is continually evaluating the effectiveness of their treatments and the level of the patient's suffering, and providing access to palliative care resources if they feel it fits or if the patient requests it.
First, when discussing symptom management, it's really important to note that the parents or the legal guardians make the final call for treatments and if it's right to put the child on palliative care, things like that. Non-pharmacological methods to decrease symptoms are a really great way to reduce pain and anxiety in kids. Some examples include cuddling, massage, heat or cold therapy, meditation, imaginative play, distraction, and music and art. And then, of course, when the child nears end-of-life care, drugs are used more aggressively to increase the quality of life. Some of these drugs include opioids and ketamine for pain. Opioids are also used for dyspnea. Benzodiazepines are used for anxiety, seizures, and agitation. Anticholinergic drugs are used for agitation as well. Antipsychotics are used to manage anxiety, delirium, and insomnia. And then palliative sedation is also used as like a last-ditch effort to provide the patient with some relief. And some of these drug classes include pediatric drugs specially made for kids, and others are just given at a reduced dose.
Communication with a child patient is different than with an adult. Children have different stages of development and parents who would like to protect them. There are some key points to hit when talking with a pediatric patient. First is you should reassure the child that the disease is not their fault. A lot of children feel that they put this disease on them because of bad behavior or things like that. Encourage the child to express their feelings regarding the situation. Have an open line of communication. If a child brings up the topic of dying, do not avoid it. also let them know that they are loved. While communicating with the child, you also have to keep in mind the parent's wishes. Some parents would like to have that discussion with the child themselves. And you also have to remember the child's developmental level, as it might be beneficial to exclude some of the scarier topics. It also can be beneficial to include siblings in the conversation.
Okay, so when a child is diagnosed with a terminal illness, they may utilize a lot of defense mechanisms that the parents may recognize that's unlike the child. These can include anger, crying, denial, information seeking, play and fantasy, and silence. It's important to reassure the parents that it is normal for the child to act out of character when they're faced with such a stressful situation, and that every child is going to respond differently. It's essential to include a child life specialist when planning care for this child and the whole family, because these folks can assist to create healthy coping skills, and they're a really important piece of the care team. The sick child sibling should not be forgotten in care of the patient. Research shows that giving siblings accurate and age-appropriate information results in the most positive outcomes for siblings of sick children. Oftentimes, when a parent downplays the illness or simplifies it too much, the sibling will imagine it to be much worse than it is, and that closes the line of communication between the sibling and the parent. And of course, reassure the sibling that it is not their fault and that they did not get their sibling sick. Similar to when you're advising the parents on how to manage the siblings, the parents' coping must be taken into account as well. Reassure that it is normal to feel a wide range of emotions when the child is placed on palliative care, and allow them to express those emotions in a safe way. Again, get child life involved as well as a social worker or a psych consult to discuss feelings and options with the parents.
So a study was done to examine the difference with pediatric patients receiving palliative care versus not receiving palliative care. So it was a 6-year study done between 2002 and 2008, and they were specifically looking at the pediatric patients' symptom distress from the cancer, and then their overall quality of life and experience during this time. So 60 parents were surveyed, so 30 children receiving palliative care and 30 not receiving palliative care. It was found that the patients receiving palliative care were significantly more likely to have fun. They were surveyed, and 70% of the patients receiving palliative care reported to have fun experiences, versus only 45% stated receiving or stated having fun experiences that were not receiving palliative care. The patients receiving palliative care stated to experience events that added meaning to life. So 89% of the 30 children receiving palliative care stated to have received experiences that added meaning to their life, versus 63 that stated they did not. And then the patients receiving palliative care were more likely to be constipated. That was found, but that was an issue that the study was found to, they were able to resolve this problem with the patients. That was mostly opioid induced. And then overall, it was found that pediatric patients not receiving palliative care had a more difficult time managing distress symptoms versus the patients that were receiving that were not receiving palliative care.
Alrighty, so basically, why is it relevant? And that is, it's very important that pediatric palliative care be talked about, just because it's already difficult for people with terminal illness to broach the topic of palliative care or discuss their illness, but it's very important because discussing it with the patients, the parents, or legal guardians is an essential part of ensuring that the patients, especially the children, experience limited suffering. Some literature suggested that those experiencing a terminal illness at younger ages actually experience more distress than the elderly, as they may be going through major life milestones in development that can be really dramatically altered from a terminal illness. So it's really important to discuss palliative care, as it can really provide support for the family and them while they manage their illness, physically, emotionally, spiritually. Such therapies might include, but aren't limited to, education, grief and family counseling, peer support, music therapy, child life intervention, or spiritual support for both the parents and the siblings, as well as respite care. Respite care is really important as well for the families to have some time to rest and renew while they're trying to cope with their own lives and take care of siblings, significant others, as well as themselves during this time. Overall, it's just really important that information about and referrals to palliative care be easily accessible for patients of all ages, even children, just really to help improve their quality of life if they are experiencing a terminal illness.
All right, so what surprised us while doing our research with this topic is the lack of funding that pediatric cancer actually gets. As we said before, they only receive about 4%, and the lack of funding has made it hard to get drugs specifically for pediatric cancer. Another thing that we came about is that when you're explaining things, you have to remember the developmental level of the child. A lot of the times the child doesn't understand what is happening, why it's happening, and it can be hard on the not only the family but also on the nurse trying to explain to a child why they're so sick. So in conclusion, palliative care has a lot of interdisciplinary teamwork. It can involve social workers, caseworkers, child psychologists, PT, OT, speech therapy, things of that sort. And a lot of the key points that we want to hit on and drive home is that communication is key. Have an open line of communication with your child, have family involvement, and then have a holistic care approach. It's not just about symptom management, it's about also making sure that the child has a good quality of life and has the ability to act like a child. Thank you. Oh, and here's our references.